Again, topic used to be talked. In last lecture, I was discussing about the topic called oral contraceptive. In that, I have covered the combined pills, EOP, progesterone only pills, male pills. What is remaining is post-conceptional and miscellaneous. Today I will discuss the post-conceptional and the injectable types of hormonal contraceptives. So what is meant by post-conceptional? Post-conceptional means once the pregnancy has occurred, means the sperm and the ovum has met, and after that ovum has implanted on the posterior margin of the uterus. Ovum has to be implanted on the posterior margin, which is a normal thing. Then that product is called as conceptional product, means pregnancy is there and fetus gets mature. So what to do? Because still we have got few measures, few ways to terminate the pregnancy. The first is yama, means menstrual regulation. Because once this conception occurs, menstruation stops. There is no menstruation. So we have to start the menstrual cycle, and it has to be regulated. That's why this is called a menstrual cycle. What is done in this? The conceptional products of conception from the uterine cavity has to be aspirated with the suction machine. This has to be done within the 6 weeks of pregnancy. Then only this aspiration or a suction evacuation becomes successful. Maybe under local or under the general anesthesia, depending upon the patient's pain tolerance. Second is the abortion, or that is called as, in medical terminology, it is called as medical termination of pregnancy, MTP. So abortion is a layman thing, a layman word. MTP is a medical word. Meaning is one and the same. There are two types of abortion. One is natural abortion, and second is one is natural abortion which occurs spontaneously because uterus is unable to continue the pregnancy. So there occurs the contraction of the uterine muscles, and those products of conception are expelled out naturally. That is called as natural abortion. Number 2 abortion is called as induced abortion. What is done in this induced abortion? In induced abortion, what is done is we inject prostaglandins in the uterine cavity, and uterine muscle tone increases, uterine muscle gets contracted, and that products of conception are expelled out, and termination of pregnancy occurs. So for this, there is a law called as MTP Act 1971. This law is amended in the Lok Sabha, Indian Parliament, in 1971. At present, around 6 million females are getting done this MTP per year in India. This is Indian figure. 6 million females, they undergo MTP, maybe spontaneous or induced. So this is about the post-conceptional. Miscellaneous thing I will discuss tomorrow. But in hormonal contraceptive, injectable part is remaining. I will discuss this. Injectable hormonal contraceptives, they are classified under 3 headings. Injectable means which are given by injection. Vaginal means they are kept into the vagina. Subdermal implants, they are implanted in the forearm or the axilla or the medial side of the thigh. Everything has content of steroid hormones. Remember this. And hormones has got side effect. So these are the two injections which are used in practice. DMPA, Depot, medroxy, progesterone acetate. This is an injection which is given 300 milligram intramuscularly. Actions last for 90 days, 3 months. Action lasts for 3 months, 90 days. But remember, after the 90 days, injection has to be repeated. But best way to not to take this injection. Again, I am telling you, this has got many side effects. Other simple ways of contraceptives you can advocate rather than going to the hormone. So again, the mechanism of action is it acts on the pituitary gland, gonadotropins, and it prevents the release of the ovum from the ovary. This is the central action. This acts centrally. Net enantate is another injection. This is given 200 milligram intramuscularly. Action lasts for only 60 days, 2 months. 2 months. Again, after 2 months, this has to be repeated. Another simple thing about the hormonal thing is vaginal rings. These are the rubber rings which are kept into the vagina, which contains 35 milligram of norgesterol, norethisterasterol, and they are absorbed through the vaginal mucosa gradually, and it releases this hormone slowly, and female is unable to conceive. So what is the procedure of this is, you keep this vaginal ring for 3 weeks, and in 4th week this ring has to be removed. This has to be repeated after the 1 week. That's why this is not in practice. Subdermal implants is more common in working females. These implants again contains 35 milligram norgesterol, and these implants are implanted forearm or axilla or middle aspect of the thigh. As they are implanted, as the word subdermal, below the dermis level, dermal level, they are small incision is taken and they are kept there. This releases the steroid in a small quantity, and patient is unable to conceive. So the idea is not to get the pregnancy. So only last topic remaining in this topic.